As Chair of the National LGBTI Health Alliance, I would like to say welcome to the 9th Health Indifference Conference here in Canberra. The Alliance would like to honour the LGBTI elders who have gone before us. Their strength, courage and optimism have and continue to support us in our progress each and every day. You are here because you recognise the importance and the might of working together for our health and well-being. As we all know, ours is not a homogenous group. We do, however, have a history of working together and a future of doing greater things for the betterment of everyone. Last month, I attended the Safe Schools Coalition Symposium, attended by over 100 young people. These young people are inspired by what they have achieved and what they can do, and they are excited by the difference around them. These young people and their teachers were energised by each other's stories and courage. The coming generation are amazing. This next generation of change makers, and many of you are here, are able to learn from both the successes and the pitfalls of our activism, lessons learnt from navigating each other's spaces and experiences, and those of politicians, governments, and other change makers. Throughout these 3 days, you will hear of great work and unique life experiences. And this entire delegation will have the opportunity to share with others learnings and knowledge from every part of Australia and beyond. I need to point out some essential information in the handbook, all of it. In particular, we do all aim for a safe and inclusive conference where everyone is supported, respected, and acknowledged. There is very valuable information to ensure the very best outcomes, and you'll find it on pages 14, 15, and 16. And you will find it really useful to hand on to colleagues after the conference. As Chair, I welcome your feedback in the breaks on this and other projects of the Alliance. The Alliance is as strong as its supportive and engaged membership and the communities that surround us. I would now like to welcome Senator Dean Smith to officially open this, the 9th Health Indifference Conference. Dean has been a precious supporter of the Alliance and of our work in aged care, and in his home state supporting work in aged care. Thank you, Dean.
Well, to Matilda, can I thank you very, very much for that very generous, warm and entertaining welcome to country, and can I also pay my respects to the traditional owners past and present. Can I acknowledge the President of the Human Rights Commission, Gillian Trigg, it's great to see you. Can I acknowledge also those other parliamentary colleagues who I haven't yet seen, and it's always a risk for parliamentarians to start naming them, so if there are any here, I extend my acknowledgements to them. Canberra has a bad reputation as being a very boring place in Australia, but I think it's fair to say that the last 36 hours have sort of put that myth to the test. As a West Australian, I often say that Canberra is unrepresentative and doesn't know the changing attitudes and the views of ordinary Australian people. And I suspect on that criticism, that is very, very true. And that's been demonstrated in the last 36 hours. But I'll come to that at the end. Thank you again, Susan, for what was a very, very warm and generous introduction. It's great to see the West Australians here. I spotted June Lowe already, so welcome to June and to all the other West Australians who know what it's like to be a federal senator now from Western Australia traversing our country. But it is a great pleasure to be here at the opening of this Health Indifference 2015 conference. At the outset, and on behalf of the Minister for Health, Susan Lee, can I extend to you all very, very warm congratulations, and particularly to the National LGBTI Health Alliance for putting together such a comprehensive and thoughtful conference program over the next 3 days. What I think is especially important about this conference, and indeed about the advocacy activities of the LGBTI Health Alliance more broadly, is the way it considers the full gamut of issues impacting upon the health of the LGBTI community, be that mental, physical or emotional health. It's especially pleasing to see the agenda for this conference feature sessions that focus on matters including ageing and aged care issues for LGBTI Australians, and of course for Indigenous Australians, an area of which I've had a long-standing and hope to have a long-standing interest into the future. We all understand that Australia has an ageing population, and ageing is a process that unfortunately happens to all of us, including LGBTI Australians. The most powerful thing that was said to me about ageing and about coming out was said to me when I was 41. I wish it was said to me when I was 22, and that is that the coming out process never ends. You start with one coming out experience, and then we are expected, we are required to constantly come out to friends and families, to workplaces, indeed to parliaments, should we get elected. I think for too long the aged care sector and those involved in decision making have failed to appreciate some of the sensitivities and challenges experienced by LGBTI Australians as they grow older. I'm pleased this is beginning to change, and it's especially gratifying to see such a significant focus on these issues forming part of this conference. As we know, the mental health issues are another acute challenge for those of us in the LGBTI community, and the delivery of the Mind Out mental health and suicide prevention project through the LGBTI Health Alliance is incredibly significant in suicide prevention and alleviating the feelings of isolation and loneliness that can sometimes take hold. Of course, these issues are applicable to LGBTI Australians of all ages, but they're especially acute among younger people and those in regional and remote areas who are struggling to come to terms with their sexuality. Likewise, it's good to see issues surrounding methamphetamine use, once upon a time not a popular point of discussion. Indeed, it has its own language. For a time, it had its own secret words. But it's important that the LGBTI community step up and own some of these very, very sensitive and difficult issues in the same way that other Australian communities are expected to step up and own these issues. The ice epidemic, as we know, is one that transcends social economic status, the urban-rural divide, educational attainment, gender, race and indeed sexuality. As the federal government has recognised earlier this year when it established the National Ice Task Force, this problem is wreaking havoc on communities across Australia, and I hope that those who have been involved in the discussions on this issue, on this abuse, will consider how the LGBTI community can play an active role in addressing this critical issue. A good speech from a politician is a short speech, but I do want to address one brief issue. There is an overriding issue that has dominated federal politics this week. It's one that is of keen interest to me. It's one that I know will be keen interest to many, if not all of you. Out of respect for each and every one of you, it would be remiss of me not to mention this week's developments in regards to the sensitive but important issue of same-sex marriage. I'm sure it will come as no surprise to most of you, especially if you've followed the news over the past 24 hours, that I've been disappointed by the turn of events that have taken place this week. I recognise the debate on whether to afford equality before the law for all consenting adult relationships between two people is one that involves complexity, great sensitivity, and it does give rise to strongly held views throughout our community, throughout our parliaments. But during the party room discussion that happened on Tuesday, I reiterated my previously stated view, and I absolutely accept that I have been a bit of a slow learner when it comes to the merits of marriage equality, but that demonstrates an important point, that some of us will take a little bit longer, some of us won't take very long at all, but as long as people finally get there, that's the outcome that we're seeking. But in that party room discussion, I reiterated my previously stated view that relationships between two consenting adults should be afforded equal recognition before the law. Full stop. This includes legalised... And of course, this must include recognising marriages between two persons of the same sex. I also affirm my strong view that given this issue is so heavily governed by a person's attitude to faith and sexuality, it is obvious, it is crystal clear that every parliamentarian should be able to vote, should be free to vote according to his or her own conscience. This, for my own party and my own traditions, this would be entirely consistent with the previous Liberal Party practice which required significant changes to marriage laws in the past, where Liberal parliamentarians were granted a conscience vote. This included the important parliamentary debates on the Matrimonial Causes Bill of, and I don't think many were there, 1959, the Marriage Bill of 1961, some of us might have been there, and I pay my respects to the elders of our LGBTI community, and the Family Law Bill of 1974 when I was all of but 5. I'm disappointed there has been such a significant departure from previous custom and practice of my own party, the Parliamentary Liberal Party. My overriding consideration in forming a view on this matter is one of equality before the law. In contemporary Australian society, it is no longer defensible for the state to deny proper and equal recognition of a marriage between two consenting adults simply based on their sexuality. I've indicated that should a bill to legalise same-sex marriage come before the Senate, it would be my intention to support it. Clearly, this... Importantly, this week's events don't put an end to the debate. Let me be a little bit controversial, and apologies to those that have fought hard on this issue for a long time. I suspect in some quarters the debate is just starting. But going forward, I would urge each and one of us to be patient with people like myself who've taken a little bit more time than others, but to try ever so harder with calm, with consideration, with grace, to make sure that the discussions are conducted in an atmosphere of respect and understanding, as I know each one of you will. And of course, this applies to those who are opposed to same-sex marriage also. Very, very finally, can I just say this? There aren't many openly gay men and women in our parliaments. And it is true that my journey has been different from some of yours. Indeed, your journey will be different to my journey. And sitting in the crowd listening to the presentations, I know that my journey can't ever be like that of other people. But as Ben Lee said, we are all in this together. We are all in this together. And can I just apologise to Gillian that I won't be able to stay for all of your contribution. Can I apologise to each of you that I won't be able to stay for this afternoon's considerations? Well, I will have to get back to Parliament to stand for the principles that are important to me, to stand up for issues that are important to some of you. But can I recommit myself as an openly gay man in our federal Parliament? Some issues are beyond politics. Some issues require great care and energy, and I recommit myself to supporting those issues and those causes that are important to each of you. Thank you very much.